So now they're recording. I'm gonna say hello again, like I didn't say before. So hello, Adrian. Thank you for coming to COVID Talks. How are you doing? You said it's been a crazy 3 months. You want to talk a little bit about that?
It's been busy. This is a very unprecedented time. I think no one has expected. No one knew coming in what this was going to look like. I think we still don't know what this looks like.
Mhm.
So I mean, it's been a continuous process of responding, reacting, best guesses, and calming the general public.
Okay. So Adrian, going to my intro here, we have the most cases in the world, and the number is growing daily. I'm going to share my screen and pull up the latest WHO situation report. That should be report 152, I do believe. And here's the situation report. So this is of yesterday. This information, I believe, came in at 10 a.m. yesterday. So over 2 million cases, 23,000 new confirmed cases, over 118,000 total deaths, and 733 new deaths yesterday, June 20th at 10 a.m. So those are just some statistics that we have for the US today. Let me stop sharing my screen. So despite this, the country is trying to reopen many things, and many people, notably people I have encountered, have zero fear of the virus or the pandemic whatsoever. So I'm doing this. This is to get a viewpoint that's about helping people, not politics, because I feel like a lot of when I hear people say like, oh, I don't think COVID is a big deal, I'm not worried about it. I think, well, how could you not be worried about it? I'm hearing it everywhere, but that's because I'm hearing it from my news sources. But the news sources that everyone uses and everyone trusts in this country are different. So I want something that is not dependent on your news source, not dependent on your political party. It's just from medical professionals whose job is to help people and keep them safe and alive. And that's what it's about. So that being said, I know you are a medical professional, not an epidemiologist. So we'll be looking mainly at how COVID is affecting your work life, not expert advice on how to move the world forward. It is okay to say you don't know. So are you ready, and do you have any more questions?
No. I think we can move forward. I definitely will tell you if I don't know something, which is a
Okay,
lot.
okay, great. So Adrian, what is your job? How do you help people, and how long have you been doing it?
Okay. Well, I'm a pharmacist in the state of Virginia. I work for Carillion Clinic, which is the largest healthcare provider in the southwestern part of the state. We service an area of about 1 million patients, and everywhere from Lexington down to Giles County and further down into southwestern Virginia.
Mm,
So our patient population looks very much like the population down in Boone. It's very much the same. I'm the director of the retail pharmacies. We have 6 retail pharmacies which service the community as well as our employees and dependents. So I've been doing that. I've been in the director position for about 6 years. I also work very closely with the Virginia Pharmacists Association, which is our state association,
mhm.
which is an advocate for pharmacist rights and roles, and giving us as many, trying to explain to the public and our legislators the role that pharmacists play in healthcare.
Okay.
Just a disclaimer, I'm not talking on behalf of Carillion Clinic or on behalf of the Virginia Pharmacists Association.
Mhm.
These opinions are mine and mine only.
Okay.
But I'm trying to I'll give you a personal as well as a professional perspective.
Okay, cool. So in particular, how do you help people on your job?
Well, my role is mainly as an administrator.
Okay.
So I had to really I had to put my administrator hat on very, very tightly a couple of
Mhm.
months ago and determine what was the best way to react and protect my staff as
Mhm.
well as our patients that were coming into our pharmacies.
Okay.
And as you know, the pharmacy is one of the most accessible, if not the most accessible, healthcare provider in the spectrum,
Hmm.
because we're there all the time. The lights don't turn off. Patients come to us and they see us and they ask us questions that, like if they can't contact their primary care providers or their nursing staffs, which a lot of them closed or reduced hours during the pandemic. They
Okay.
come to their pharmacist.
Okay. All right. Thank you. So next question, how has COVID changed things on your job?
Uh, it's greatly impacted my job. You know, I think we all know that the economy has taken a downturn, so people have had to make the decision to, pay for their prescriptions or go without them.
Hmm.
Especially when a lot of them have reduced out incomes.
Hmm.
So volumes have decreased. However, the responsibilities of the pharmacies have not decreased.
Okay.
Uh, in fact, we've had to take on a greater role because we've had to respond very quickly by um, raising up barriers in the pharmacies. I'm sure you've gone to the grocery stores and you've seen the barriers that went up very quickly. We had to
Hmm.
go ahead and put those up. We had to start instituting mask policies as well as face shield policies. And, those policies and procedures were changing day to day.
Hmm.
I mean, almost hourly in the beginning.
Wow.
And, my responsibility was to make sure my staff and my patients knew what to do and what were the most frequently asked questions. We were doing daily huddles at first with the infectious disease department and our COVID task team. There was a ton of communication, and it was really tough in the beginning because, and not to be political, but our upper echelon of leadership in our government was giving us very mixed messages,
Hmm.
and that made it very difficult. When you have mixed messaging, then people are just going to start looking for answers from everywhere.
Okay.
And so that level of confusion led to panic. And, you could see that in the toilet paper hoarding and all other sorts of, you know, un, un, unhelpful behaviors.
Hmm.
But that's how my job has changed. Is there's been a ton of compliance. There's been a ton of questions that I have to answer on a daily basis. We're constantly revising procedures, so it's made my job a tad bit more complicated.
Hmm.
But it's all under the aegis of making of patient safety.
How is COVID-19 different from the flu?
Um, I'm not a pathologist or an epidemiologist,
Hmm.
so I mean I can only tell you in broad strokes. They're very different types of viruses.
Hmm.
They have different infection rates as well as different types of virility. They
Hmm.
affect patient populations much differently, and I'd say, just as a layperson, um, the difference between the flu virus and COVID or the coronavirus
Hmm.
is that there's so much more we don't know about it.
Hmm.
Um, they're the what we have as scientists and healthcare providers, what enables us to um, protect our patients and protect our communities is that we have evidence-based scientific data, and we're able to make decisions based on large amounts of data, large amounts of evidence, and I don't think we have that right now. It's certainly coming in now more than ever, but there's still a whole lot we don't know. I mean, it's just we still can't determine if an antibody test is effective or useful. We
Hmm.
don't know when to give an antibody test to see if it's effective. We don't know for how long. We don't know if you have the antibodies that you are even prevented or protected from another infection.
Hmm.
So there's a lot of questions out there.
And particularly in your sphere of work, I guess you've never had, a time without the flu. So I guess the flu is normal. But I guess in your sphere of work, the response to COVID has definitely been different than the response to the typical flu season.
Yeah, I definitely believe that, and it's just because there's so many unknowns. We thought in the beginning they were saying that the mortality rate of someone that was infected with COVID was around, I heard as high as 30%. We know it's much lower now.
Hmm.
Um, that doesn't take away the fact that you know there are still uh, refrigerated vans outside in New York City that are storing bodies because they don't have enough capacity to take care of all these patients. And there's still a significant amount of people dying from COVID,
Hmm.
regardless of how they're taking count of those deaths. And I know there's been some ambiguity with the statistics, but you and I both know that statistics can always be manipulated.
Hmm.
And unfortunately, like you said in the beginning, unfortunately, there's been a political, it's been politicized when it doesn't need to be.
And I'm actually talking about statistics. I'm actually going to go into some, as I said before. I did some research before I started these, so just want to give some statistics. WHO, World Health Organization, says that influenza pretty much is easier to transmit, but COVID-19 has more severe and critical cases. Now, the CDC estimates that influenza was associated with more than 35.5 million illnesses, more than 16.5 million medical visits, 490,600 hospitalizations, and 34,200 deaths during the 2018-2019 influenza season. Now, if we go back to the report from WHO from yesterday at 10 o'clock a.m., we have 34,200 deaths last year from influenza. That's from CDC, and 118,205 deaths and counting from COVID-19. Now, that 118,205 is constantly growing. It is larger now than it was yesterday at 200. I'm sorry, yesterday at 10 o'clock a.m. So we're seeing that COVID already is killing more than 3 times. And like I said, it's still going. And then on top of that, they were talking about the ratio of COVID cases that became severe and critical are higher of those of influenza. So that means that even though COVID is killing more than the flu, 5% of those cases are critical, 15% are severe infection, which means 3 times the number that are dying, possibly, are getting severe infections, which means those people are going to be filling up hospitals and things like that, taking up beds. So those are the stats, like I said, from CDC and WHO. Now, my understanding of the dangers of COVID are, one, how it relates to killing people and how it relates to hospitals. So with killing people, my understanding is that, flu is more about protecting yourself because, you have the opportunity to get the what is it called? The shot, the vaccination, if you so choose. And if you do not, then you're taking that risk with yourself. For COVID, my understanding is that it's more about you're protecting others because the person who's going to suffer from COVID isn't going to be someone you see. For example, I go to work during the week. So if I get COVID from someone at my job, my parents just came up last week and a few weekends ago to give me a bike to get back and forth to work more easily. Now, if they come up, they get it from me. And then 10 days later, my mom goes to see my grandmother. My grandmother has now gotten COVID from someone. My grandmother has gotten it from my mom, who got it from me, who I got it from someone at my job. So that is my understanding of that danger. Now, the other one is hospitals, like you brought up the refrigerated trucks in New York, which means if people are getting not just dying, but, not the critical cases, maybe the severe cases. If we have so many people filling up hospitals, we run out of hospital beds, we run out of medical professionals, we run out of equipment. And then whether you have COVID or something else, maybe you broke your leg and now you can't get medical attention because all of the medical professionals are tied up with COVID cases. So that is my understanding of the dangers of COVID. How close is that to yours?
It's very similar. The thing about any type of communicable disease like influenza, we see it every year. It does affect a certain population more than others.
Mm-hmm.
Or some are. I mean, we're all susceptible to flu. but the older you are, the more in danger you are of having um, a severe run-in with the flu. The influenza severely impacts people that are elderly people, specifically over 65. It's a really real danger if they
Mhm.
catch the flu. Um, I believe with coronavirus, um, we're looking at the coronavirus from the aspect that we it's not so bad. That's what I hear all the time.
Right.
The coronavirus is not so bad. Look at it. It wasn't as bad as we thought it was going to be. But people are forgetting that the 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 precautions that we took early on, not early enough, but early on, we instituted social distancing. We had the lockdowns. We started putting out mask policies, and it was all about flattening the curve. That was the cliche term at the time.
Mm.
But I think people have really forgotten um, how that has impacted the spread of coronavirus.
Mhm.
Um, we have never taken these types of measures during influenza season, and even still, it wasn't enough.
Mhm.
There are certainly states that have were able to mitigate the spread so that they did not tax their healthcare communities as much as to the point that states that have been impacted very very hard, like New York, California. I think what we're looking at right now is everyone's forgetting what we've done,
Mhm.
as well as they're also they're already starting to talk about a second wave, and honestly it's not a second wave of coronavirus. We're still in the first wave.
Mhm.
We still don't know what this is going to look like.
Mhm.
We're reopening, and we're reopening, and at some point we have to reopen. I understand that.
Mhm.
I believe that people still need to take precautions. Just you know, following proper social distancing, as well as wearing masks and washing your hands, it's still the best way to prevent the spread of coronavirus. And I wish people took it a little more seriously. I'm already seeing people not wearing masks. People are not washing their hands as rigorously as they used to.
Mhm.
We'll probably see a big rise in the next couple of weeks, and that's unfortunate.
Well, I'm glad you actually answered some of my other questions in there. We have 5 minutes before the meeting kicks us out because I did not expect it to take this long. So, one of the questions I did have, but definitely wanted to ask you in particular, is what is your experience with minorities, mainly Black people, in the workplace? Do you tend to find more worse conditions, less insurance, access to healthcare? And for you in particular, what is your experience being Black in the workplace? Are you better able to spot differences in healthcare? Are you better able to do something about it?
That's a that's a big question. There's a lot going on there. Um, I live and I work in southwestern Virginia.
Hmm.
It's a rural community, and I am not from this area, so I definitely have a perspective on things that is different from from someone that has been born and raised here in southwestern Virginia.
Hmm.
Um, and yes, I do feel like there's definitely a disparity in just in healthcare workers
Hmm.
in southwestern Virginia, and there's definitely a different level of care.
Okay.
Um, I mean, I don't want to downplay it. In southwestern Virginia, what I see more than anything is the disparity is in um, it's socioeconomic. I mean, there's poor whites and there's poor blacks in the communities here, but there's certainly in Roanoke City, in the area that I live in, um, minorities are relegated to a certain part of the city that they don't have the ability to get to. They don't have access to care for one.
Hmm.
A lot of them are uninsured or underinsured, and that certainly impacts the level of care that they receive. Um, so yeah, I do see that. I think that preventative care, regardless of what anybody thinks, pharmacists would rather see people not on medication.
Hmm.
And an ounce of prevention is worth a pound of cure. I think preventative medicine is still not a priority in America's healthcare system. And I think that impacts minorities. I think it impacts people of lower socioeconomic levels. I think it impacts them the most. And it's unfortunate that that's the way our health system is broken in that manner. And it's just because we don't have access to affordable, quality health care for people in a lower socioeconomic bracket.
But if for those people who do have access, those people who are not in the lower socioeconomic brackets, do you think that they are okay, that they will be healthy, that they will actually have less to worry about, especially in terms of COVID-19?
Ask me that question again, Jordan.
You mentioned people who have less access to healthcare, less access to insurance. So can we say that maybe those people who are not in those lower socioeconomic statuses, who do have that access to healthcare and insurance, is there maybe a sort of privilege there in which they really don't have to worry about those things? And so that may make these issues more invisible for them.
Well, I'll tell you this. They've looked at spending during the coronavirus, and the people that were able to get the stimulus checks, they spent their money to pay bills, but they did not decrease spending. The people that were in higher socioeconomic brackets, they did reduce their spending, and they spent a lot more of their resources on preventing infection.
Mm-hmm.
And I think that's just because, when you don't have to worry about the day-to-day grind, you're able to focus your efforts on something else. I think with people in lower socioeconomic brackets, they don't have the time
Mm-hmm.
to worry about things like that when really they're trying to put food on the table.
Right.
And they're probably the most impacted by this virus because of the shutdown, because a lot of them have lost jobs. A lot of them are not getting the amount of money that they used to get.
Mm-hmm.
And a lot of them have jobs where they're not able to work from home, so they're just laid off.
Right. Well, thank you. The meeting didn't kick us out, which is great yet. So you have said a lot of very insightful things. I'm going to have a lot of trouble editing this because there's so much I want to keep. But before we go, is there any closing remarks, anything else you'd like to say?
No, not much. Just I will send you a link to a healthcare site that has been tracking coronavirus cases, as well as what that looks like when it comes